Hello, welcome back. Welcome to Grapham Academy, where we deal in a number of course units that expose you or that prepare you on how you can handle your patients better and well. So today is a new lecture, a new episode, and in this episode, we are going to look at what we call pharmaceutical care. So the person presenting, by the names, you can view it. And if you have issues in maybe reading or pronouncing the name, we have other audios where the name was well pronounced. Or yeah. So let's look at pharmaceutical care, and we want to see a number of things under pharmaceutical care. And we need to know how to define pharmaceutical care, what are the principal elements on pharmaceutical care, and then what's the concept, what's the pharmaceutical care concept, what are the outcomes of pharmaceutical care, what are the functions of pharmaceutical care, and then what's the aim of pharmaceutical care, what's the importance or relevance of pharmaceutical care, and then we shall look at what are the principles of pharmaceutical care in health systems, and we shall also look at a pharmacy technician's role in pharmaceutical care, or a pharmacist's role, a pharmacy professional's role in pharmaceutical care, and then what are the competences for pharmaceutical care, what is the medication-related problems in pharmaceutical care, and then examples of situations which call for comprehensive pharmaceutical care. And then we shall have another lecture on pharmaceutical care plan. So what's the definition of pharmaceutical care? So pharmaceutical care can be defined as the responsible provision of drug therapy for the purpose of achieving a definite outcome that improves the patient's quality of life. So there are three key elements that we look at care process, or that are involved in the care process. We see that the patient assessment, determining the care plan, and evaluating the outcomes. You look at assessment, determining the care plan you're going to give to this patient, and evaluating the outcomes. What can be the outcomes? Like after a patient has taken that specific care plan you have provided for them, what's the outcome? Was it good? Was it bad? If it was bad, what went wrong? What do you need to improve so that next time when a same condition is presented, you are in position to give your best. So the ability for you to consult with a patient is a key process in delivery of great or effective pharmaceutical care, and requires regular review and development regardless of experiences. Okay, so you see that pharmaceutical care is dependent upon the practice of clinical pharmacy, and we already have a lecture on clinical pharmacy. Kindly look out for it in this specific channel so that you understand the concept, the scope, what's a clinical pharmacist, what should a clinical pharmacist do, like everything about clinical pharmacy are in just one lecture. The key features of care is that the practitioner takes responsibility for the patient's drug-related needs. So what are the principal elements of pharmaceutical care? The principal elements of pharmaceutical care are that it is medication related, and it is care that is directly provided to the patient. It is provided to provide definite outcomes. Like this care you provide to a patient, what is the aim? The aim of providing this care to the patient is to reduce definite outcomes, adverse drug reactions, drug interactions. These outcomes are intended to improve the patient's quality of life, and the provider accepts her personal responsibility for that outcome. So when you are in charge of a specific patient, when you are offering this pharmaceutical care to this patient, you are accountable of any outcomes that a patient will present after swallowing or after you administering a specific pharmaceutical care plan, a specific medication related care to this patient. So in case of any adverse drug reactions, you have to take responsibility. You are accountable for it. In case of any drug interactions, adverse drug reactions, non-compliance from a patient, you are accountable for that. So you find that the whole concept of pharmaceutical care is patient-centered, whereby outcomes-oriented pharmacy practice that requires a pharmacy professional to work in concept or in concern with the patient and patient's other healthcare providers to promote health, to prevent disease, and to assess, monitor, initiate, and modify medication use to assure that drug therapy regimens are safe and effective. It is the goal of pharmaceutical care to improve an individual's patient quality of life through achievement of definite or predefined medication-related therapeutic outcomes. So we look at cure of the patient's disease. That's our main aim. Like you're making sure that whatever care you're going to offer to the patient, it should make a patient better or reduce uh, interaction with the physiological functions or modify the physiological functions of this patient's body, because there are some conditions that may not cure or are not cured, but you are modifying the physiological functions of the body in order for the patient to feel better and to live a relieved life. So, elimination or reduction of a patient's symptology, like you're reducing the symptoms of the patient, that's the patient symptology, yeah? And then arresting or slowing of a disease process. And you should also be in position to provide or prevention of disease. Like you should be in position to educate a patient how they can prevent that disease from reoccurring or coming up again. So what are the functions? So the outcomes involves three major functions. That is identifying the potential and the actual drug related problems, okay, before you administer the drug, so that you are prepared for whatever comes up, like the outcomes of whatever you have administered. You have to be accountable and you have to explain in case it is a bad outcome. Yeah. So resolving actual drug related problems, you find that it enables to resolve drug related problems, and then preventing potential drug related problems also happens or takes place. So what's the main aim? Excuse me. What's the main aim or aims of pharmaceutical care? We see that it aims at safety of drug therapy and effectiveness or effective drug therapy, and improve the quality of life, and also looking at economic drug therapy. What is the importance of pharmaceutical care? The concept offers professional development and growth. In order to deliver pharmaceutical care, professionals in pharmacy practice need to expand their role and skills. This is what brings about professional development and growth. Okay, so pharmaceutical care increases public awareness of the role of a pharmacy professional, patients, and public trust is earned as a pharmacy professionals get involved more in patient care activities such as patient assessment, counseling, monitoring, and patient education. You may have a number of topics that you would like to educate your patients on, basing on the condition that they have presented with. You can present education on non-pharmacological treatments or management, and then prevention, majorly prevention, so that this condition does not resurface again. What are the principles of pharmaceutical care in health systems? So we see that there is determination, a principle of determination of drug needs for a given patient, and the provision of necessary services before, during, and after treatment, ensuring optimum, safe, and effective therapy. Pharmaceutical care involves monitoring and evaluation of drug therapy outcomes. Okay, so you're looking at whatever you have given a patient, you need to monitor how they are complying to that medication. You need to monitor how any drug interactions, any adverse drug reactions that may come up, and then the evaluation that you give or that you will have arrived at should I'll give you an overview of the type of care, the quality of pharmaceutical care that you have offered to your patient. Creating awareness and commitment to the patient's interest. As a pharmacy professional, you are expected to bring an advocate for the patient's rights, right? The concept goes beyond the idea of professional services. It adds a dimension of concerns and commitments, right? So we also look at protecting a patient from harmful effects of the drug is also another principle. So what's your role as a pharmacy professional, and here more specifically a pharmacy technician in pharmaceutical care? In our country, pharmacy technicians are personnel or healthcare providers who have pursued a diploma in pharmacy from any recognized institution around the country, and they are licensed to operate or to do their work. They are trained, they undergo training. I don't know about your country. You can put in the comment section and we hear from you whether you also have this cadre in the pharmacy as pharmacy professionals. Compounding, dispensing drugs, and advising both health professionals and patients on proper medicine use. You are involved in compounding, dispensing drugs, and advising both health professionals and patients. How do you advise health professionals? You are going to share information to your health professionals or your co-workers at work, majorly basing on the patient's condition, the choice of medications for your patient, and any other complications that may arise as a result of a patient taking a specific chosen medication to be administered to the patient. So you have to share that information. And in case you're dispensing and you're dealing with a prescription and there is an issue on a prescription, there is what you call liaising with the prescribers. So you find that you're going to share information in the process of liaising with them, and you're able to share information with them, and you're able to correct the prescription in case it had issues, maybe drug interaction. You suspect maybe the lifestyle of a patient may affect the activity of the drug, so you can change a specific drug that works the same way as the one they had already prescribed, and you cannot change it on your own. You have to liaise with a prescriber and let a prescriber change it. All right. Making use of their knowledge, they should make use of their knowledge, skill, and experience to serve patients and clients effectively or efficiently. Should be in position to discuss and counsel patients on their drug-related problem or personal health problems. Should be in position to take hold of the health and safety of the patient as a priority in practice by giving each patient adequate attention. Also, we see that the competences for pharmaceutical care, we see that competence is the ability to perform a function or to do something. And we already saw what pharmaceutical care is based on. So the competence for pharmaceutical care means that a practitioner has the required knowledge, skill, and attitude necessary to provide appropriate pharmaceutical care. So what are some of these things that we are looking out for? There should be ability to solve a problem and make a decision. A patient has presented to you with a problem. Are you knowledgeable enough to solve the problem a patient has come with? Are you knowledgeable enough? Are you skilled enough? Are you well equipped to be in position to make the decision based on what a patient has presented with, or based on the history that you have taken from the patient? Ability to manage patient and resources, ability to communicate, and then we see that there should be ability to participate in research and development, and ability to learn further. You should be open to learn, and every day is for learning, so you should be open and flexible, not rigid. You should be in position to learn. What are some of the medication-related problems? It is an evident or a circumstance involving medication therapy that actually or potentially interferes with an optimum outcome for a specific patient. We see that the categories of medication-related problems may include this: untreated indication. A patient has come, you're giving them a wrong medication for wrong indication, so it becomes a problem. Improper drug selection, you fail to make a decision based on what a patient has given you. With all the knowledge that you have attained from your training, you should be in position to give or select the right medication for the right alignment or right condition or indication. There is also a problem of subtherapeutic dosage. We also have problems to receive medications or failure to receive medications. That is when you always have stockouts, maybe because you did not procure early, so you may fail to receive medications. Or a patient may fail to receive the medication in time, basing on a number of factors. Either the route of administration, they are not compatible with it or comfortable with it, or any other issue that maybe the religion they are in doesn't support specific drugs. For example, maybe Catholics do not promote family planning, and yet you are encouraging this patient basing on what they have explained to you or what they have presented with. You are informing them about the medication. Okay, so you find that this patient may fail to receive that family planning based on the belief that they have. I don't know about other religions, and do not feel offended if you're not a Catholic and it is not maybe preferring this to that. And if you are Catholic, also you should appreciate, I think, what I am trying to say. There is overdosage. There may be overdosage. It is a very big medication-related problem that can affect physiological function of our patient's body. Adverse drug reactions, drug interactions. We have a lecture on adverse drug reactions in this channel. Kindly look out for it, as well as drug interaction and then medication use without indication. You find that this majorly happens with self-medication. You are swallowing a specific medication that you don't have its indication. So what are the bases of drug-related problems? We see that what brings these problems that we have looked at in the last or in the previous slide. We have inappropriate prescribing, where we have inappropriate regimens are prescribed to a specific patient. Form of drugs, dosage form, the dose, the route of administration, or dosage intervals and duration. And then unnecessary regimens are also given sometimes. We also have improper delivery, where we have drugs are not available in your facility and you are telling patients or medications are out of stock, go and buy, out of stock, this and that. Then dispensing errors can also be involved. We are continuing with the basis, where we have inappropriate behavior by patients. Some of the patients are not compliant to the regimens that they are given. So non-compliance and compliance with inappropriate regimens. Okay, a patient can obediently or religiously take the medication based on what you've explained, and yet that medication is inappropriate for the condition that they are suffering. We have patient idiosyncrasy. We also have inappropriate monitoring of medication. So what are some of the examples of situations which call for comprehensive pharmaceutical care? Patients who are particularly vulnerable to adverse drug reaction because they are physiologically compromised. Okay, for example, we have infants, we have the elderly, those with kidney issues. Where if you have watched a lecture or attended a lecture on adverse drug reaction and drug interaction, you would really appreciate why we are putting emphasis on those with kidney issues, those with liver issues, and respiratory failure. Okay, so these are physiological organs that most of these drugs activities are done there. Patients with medical conditions that require ongoing evaluation and manipulation of drug therapy to achieve optimal results also have to be put into consideration. You need to be critical enough and offer this care to them. Patients who are taking multiple medications, thereby placing them at a high risk for complex drug disease interactions or for drug food interactions. Okay, so we are continuing patients requiring therapy with drugs that can be extremely toxic, especially if they are dosed, administered, or used inappropriately. You also have to offer the care to them. And then patients whose acute illness can become life-threatening if prescribed medications are ineffective or used inappropriately. We come to the end of this lecture. Thank you so much for listening. Stay tuned to Graphomme Academy. Subscribe, like, and share to content in this channel.